talk about the ligaments. The ligaments that hold all this together. When identifying ligaments, like most things with anatomy, if you can group them into categories, it makes them a little easier to understand in kind of bite-sized chunks. So we're going to do 9 ligaments that are exceptions of the bone-to-bone rule. There's 9 of them. Okay? These are 9 exceptions of the bone-to-bone rule. So my first 3 are going to be my check ligaments. So I'm going to have my subcarpal, check, my subtarsal, check, and my radial check. Now my radial check ligament originates at the radius, forcing distal inserts in the superficial flexor tendon. And my subcarpal check originates in the distal end of the carpus, forces distal inserts into my deep flexor. The subcarpal is also known as the inferior check, and it's inferior because of its position, not because of its size or strength. It is, in fact, the strongest, thickest, heaviest check ligament, but it's called inferior. That's called superior. It's called inferior just because of where it is, not because of its size. My subtarsal check is only on the pelvic limb. It's sometimes absent, is usually absent in mules, sometimes absent in horses, and it can always be considered vestigial. If you look at this model here, you can see, well, you can't see very well probably, but right there's a division where my subcarpal check comes in. This is out back here, my superficial. This is my deep. My subcarpal is a large part of that mass right there, my deep flexor. On my pelvic limb, my subtarsal looks like a piece of spaghetti. You guys see that right there? It's that thin little strand. So my subtarsal is much, much thinner and is not able to do as much as the other check ligaments. The check ligaments do as the name would imply. They keep the tendons in check. They keep the tendons from being overstressed. Okay? All right, so next we have the chondro ligaments. And these are the ligaments that connect the lateral cartilages to the area that they live in. So you have your chondrocompedal, you got your chondrotendinous, chondroungular, and chondrocornal. Okay, so we'll draw a coffin bone here. And then my lateral cartilages come off the coffin bone, off the wings here, like so. You get the question. P2 is going to be sitting up here, and P1 is going to be here. Okay, my chondrocomedal connect the lateral cartilages to distal P1. Those lateral cartilages are pretty large there, aren't they? My chondrotendinous going to connect my lateral cartilages to the main extensor tendon. My chondrocornal will connect the lateral cartilages to P2, and my chondroungular will connect the lateral cartilages here to P3. So all 4 of those are exceptions of the bone-to-bone rule in the horse that does not have side bone. Once you have side bone, things change up a little bit. That holds my lateral cartilages in position. Okay, so that gives us 7 of them. We have the suspensory ligament, which is also known as the interosseous muscular tendon, and it is the largest ligament in the horse's leg. Reminding you that leg is from the knee or hock down. And we have the ligament of the ergot. Okay, my ligament of the ergot is going to come from the thickened skin area at the back of the pastern. As it courses dorsodistad, it may insert into the pastern, or it may insert into your distal digital annulus. Okay, my suspensory ligament originates at the palmar plantar proximal cannon. It courses distad, which means going away from the center of mass, and bifurcates at the nodule ends of splint bones. So again, like superficial flexor tendon, bifurcate means to divide into 2. Then it inserts along the proximal side, the proximal edge and the sides of the proximal sesamoids. And a smaller branch will course dorsodistad, you'll be able to see here, and insert in the main extensor tendon. So from that origin up there, the bifurcation is going to happen right there. We're going to insert here, And the smaller branch, this is called the extensor branch of the suspensory ligament, we'll insert into the main extensor tendon. Main extensor tendon coming down, P1, P2, extensor process of P3. So now in some horses, especially young horses that are kind of still under some stress, you can see this pretty clearly. This right here is the extensor branch of the suspensory ligament. And if you look through there, you can see the suspensory ligament itself and the bifurcation as well. So from here, palmar, plantar, proximal cannon, coursing diastad, bifurcating here, inserting the collateral on the sesamoids, and the smaller branch courses dorsodiastad and inserts the main extensor tendon. So where it inserts the main extensor tendon, that again makes it an exception to the bone-to-bone rule. All right, so we bit off 9 ligaments. Now we'll go over the next group. Our next group will be sesamoidian ligaments. So there's going to be 6 sesamoidian ligaments, and they hold the sesamoids in place. Now, when my wife was learning this, she used the acronym MISS-CD. So a lot of people like acronyms. They help them learn things. And so this is how she remembered it. So there's your middle sesamoidian. There's your inner sesamoidian. There's your short sesamoidian. There's your superficial. And that's also known as a Y ligament. Well, middle is known as a V. Your collateral. And then finally your deep. Your deep is also known as the X or cruciate. Okay? So those are your 6 sesamoidia. The sesamoid ligaments, we kind of draw them on some pictures that we already have here. Our collateral sesamoid ligament connects the sesamoids to actually almost the collateral ligament of the fetlog joint. One on the lateral side, one on the medial side. My inner sesamoidian ligament horizontally joins the sesamoids and forms a groove for the flexor tendons to pass over. So that's the only one of the sesamoidian ligaments that is sesamoid to sesamoid. The rest of them are either the cannon or P1 or P2. My superficial sesamoidian, that's the one that's known as the Y, originates the distal and proximal sesamoids. And you can kind of see that Y shape going there. Then inserts into P2. Beside it and behind it, so like right here and right here is our middle sesamoidian. And you'll see part of it here, and part of it there, but underneath, you won't see the rest of it because it's under the superficial. And it goes from the distal and proximal sesamoids, inserts into distal P1. You can see the shape of it though on the back of P1. So if you look at palmar P1 there, you see how it has that V shape. So the sesamoids sit right here, and that ligament runs right down there and inserts right here. And there could be some adhesions here, of course. Okay, so as I said earlier, you reflect back the suspensory ligament, cut into your fetlog joint, and give you a bird's eye view. So what you're looking at here, when I draw this, you are looking at the top of P1. And then my sesamoid bones have been pulled away from the fetlog joint. And my suspensory ligament, I'll draw my suspensory ligament a different color. My suspensory ligament is an orange, pulling it apart. So, in essence, we cut this, pulled that back, and now you're looking at the top of this with my sesamoid bones sitting here, okay? From that perspective, you can really see my deep sesamoidian obliquely joins the dorsal distal border of the sesamoids obliquely to the proximal P1, and my short sesamoidian is going to be here and here, and it joins the sesamoids proximal P1 as well. Okay, so those are your 6 sesamoidian ligaments. So we had 9 with the exceptions. Now we got 6 sesamoidians. Our next group will be our annular ligaments. So we got 3 annular ligaments. And they're going to be my palmar or plantar, depending on if it's front or hind, annular. Then I have my proximal digital. And the word digital is extremely important because it is the most proximal annular ligament in the digit. So if I just have proximal annular, then you'd think of this one up here. But if I put digital in there, you know it's in the digit. And then my distal digital annular. Now an annular ligament basically holds the tendon against the bone when the leg is flexed. And so they're going to be on the back of the leg here. Kind of have enough stuff on that drawing there. Okay. Of course, that sesamoiditis, as you can tell. Okay, my palmar plantar angular is basically going to be here. And then my proximal digital is going to come like right here. And this one almost has a, if you look at the fibers of it carefully, you'll see there's kind of a cruciate shape here. And my distal digital angular is going to be here. Okay, so all three of these, they're very, very thin. When you do your dissection, you can slip your scalpel underneath them and see your scalpel. I mean, it is such a thin tissue. And an interesting thing about the annular ligaments is that they are not elastic. So if you have a horse with a tendon problem, let's say you have a horse with a bow tendon, a low bow of the superficial flexor, now he's in trouble because this palmar annular ligament will not give. And so you'll sometimes hear him going in there and doing a desmotomy of the annular ligament. So that's to give the horse some relief whenever he's in pain. All right, so there's my three annulars. Next we have our pastern ligaments. There are two pair of pastern ligaments. There's an axial pair and an abaxial pair. Now, these are very short little binding ligaments. So my axial pair is closer to the center line of which the body would rotate. This is the back of the pastern. My abaxial pair is here. It's further away from the center line. So axial means closer to the axis. Abaxial means further from the axis. So there we only count them as two, but really there's four ligaments. After that we have our distal sesamoidian ligaments, or ligaments of the distal sesamoid, which if you remember from a minute ago, our distal sesamoid is our navicular bone. Our navicular bone is held in place by two ligaments. Okay, and then another good view. That navicular bone is pretty big compared to the other drawing. Okay, first my suspensory navicular ligament. Now it originates laterally on distal P1, goes down both sides of P2, and inserts along the proximal edge of the navicular. So you kind of think of it like a swing set. And if you look at it from a palmar view or plantar view, the origin is here. It's going to go down both sides of P2 and then insert along that top edge. Okay, so that's why you kind of think of it like a swing set. The sides of the ligaments would be the chain, the bone would be the seat. Then our impar ligament, also known as the distal navicular ligament, it goes from the dorsal edge of the navicular bone and inserts just palmar or plantar to the semilunar crest. So when my navicular bone is in position, there's my semilunar crest, the navicular bone is going to sit right there, and that point where my fingernail is, that's going to be the insertion point for the impar or distal navicular ligament. My last category is a category of ligaments that don't fit into a category. So there's four of those. There's going to be my collateral, my capsular, my interosseous, and then my plantar ligament. Okay, collateral ligaments are very numerous. You're going to find them everywhere you have bones coming together. So here would be the lateral collateral ligament of my femoral joint. That'd be my lateral collateral ligament of my pastern joint, lateral collateral ligament of my coffin joint, and they'd be on the other side as well. This here, if you remember, is collateral ligament, collateral sesamoidian ligament. So it's just short little binding ligaments. Now the capsular ligaments are like a balloon that kind of surround a joint. And that balloon makes synovial fluid, and synovial fluid is biomechanical joint fluid. So you'll hear sometimes people talk about the joint capsule. What they're talking about is this ligament here that surrounds this joint, and the inner membrane produces synovial fluid. Synovial fluid is a mixture of dialysate blood plasma and a mucopolysaccharide we call hyaluronic acid. And you guys will hear about hyaluronic acid if you've been around horses, because vets are injecting horses with hyaluronic acid, trying to change the viscosity of synovial fluid for horses that have a joint problem. My interosseous ligaments, they connect the splint bones to the cannon bone. So they're just a small little Velcro-like ligaments, very strong Velcro, kind of like that Keiko boot. But they allow the splint bones and the cannon bone to grow independent of each other. If we did not have a soft attachment between splint bones and cannon bone, if there was retarded growth or accelerated growth in one, it would adversely affect the others. And then last we have our plantar ligament. And the plantar ligament found only on the hind leg, obviously. And it goes, I'll show you on the model better. It goes from the fibular tarsal, coursing distad, and inserts in my fourth tarsal and my fourth metatarsal. So it is to the lateral side of the tarsus. You see this is lateral because look at my main extensor, my lateral extensor. And it's on the lateral side of the tarsus, and it's a very strong ligament that gives support to the hock and rigidity. All right, folks, that is a very quick and brief overview of anatomy.